Interview 101 for applying to the NICU. So although I cannot speak for all hospitals, I will tell you right now that this is something my nurse manager actually told me in the interview for the hospital in which I got hired at. She told me that something they like to ask interviewing new grad nurses is what experience they have with NICU. And of course, they know like you haven't worked there before, but have you at least been on a unit? Have you seen what the situation is like with the patients, with the bedside? Because what happens is a lot of nurses get out of nursing school and let's say they haven't done a clinical in NICU, a clinical rotation. You know, they just think it's all like cute cuddling babies all day and just bottle feeding, and it is far from it. The NICU can be very intense, especially if you work on a level 4 or a level 3 and level 4 NICU, which I do. So we see literally everything. You know, you'll see literally 22 weekers the size of your hand. So that is something that a lot of people are kind of like taken back by when they first start, having had never seen it before, and that's something that kind of like scares them away. Like they go into it thinking that it's going to be the perfect dream job, and then they're overwhelmed by like all of the million drips that some of these babies are on and just how small they are and how intense the environment it can be, and then they want to leave because they just weren't really prepared and they didn't really know what they were getting themselves into. So even though that's not the norm for everyone, the majority of people that get into the NICU, I personally think end up loving it and end up staying. But that is something that my manager told me in my interview. You know, that's something that's important that they like to ask because they don't want someone to get hired having never seen the situation, the setup, and then they get on and they get scared away. So how do you get experience on the NICU without having ever worked there? You definitely want to vouch for getting a NICU rotation, clinical rotation, while you're in your nursing program. Even if you just go shadow for a day on a unit at whatever hospital, you want to put this in your resume that you're handing to them and during the interview, and you just want to have a little section under like your experience titled NICU, what hospital it was at, what levels they were, and what things you saw and did. And literally include everything in the description. I don't care if you literally just followed around the nurse. Like I included everything that the nurse did with me, administering medications, bottle feeding babies, practice IVs, practice speaking to families, just include everything. Even if it was something you just kind of watched for like a second. They understand that you have never worked in the NICU before, but they want to know that at least you have some sort of an idea and that you got some sort of hands-on experience. Next thing you want to have prepared for your interview is your NRP. So NRP is basically BLS, which is basic life support, or CPR for NICU babies, and you can get this on American Heart Association. I wouldn't recommend getting it anywhere else because that is typically the one that all hospitals take. I originally got my NRP done at ACLS Medical because it was like cheaper, and I figured like why wouldn't they take it, and they didn't take it, and I had to redo it at American Heart Association. You can also get stable certified, but I don't think it's necessary. This is something that hospitals will pay for once you're already on the unit, and they will also offer classes to get stable certified. However, I know getting stable certified is something that can set you apart from the rest of the people who are also applying, the rest of the applicants. So if you have really been dying to get into a NICU and you haven't had any luck yet, this is something that could help you. In terms of what to expect for your NICU interview, here are a few questions that I was asked. I was asked, how would you handle a situation where a parent is in distress, and how would you respond to them? I was also asked how you would deal with medical professionals like doctors, techs, respiratory therapists, whoever, within a high stress environment. And the reason why they're asking this is because this is an ICU floor at the end of the day. They want to know that you're going to be able to work effectively with all the other people, that you're not going to get into it with doctors, that you're not going to let your stress take over you. And they want to know that you're going to respond like calmly and maturely and be like a good team player, be good with communication. So those were things I touched on in both of my responses, from the parent question to the doctor question, like how would you work with someone who is stressed out. In terms of the parent response, if I were you, I would say something along the lines of, you know, this is their baby It's completely understandable and expected that the parents are going to be stressed. So I'm going to do whatever I can to make them feel comfortable, to make them understand that their baby is safe with me and in my care, and that their baby's in the best care. Like, mom and dad are allowed to be stressed and to be scared. And it's my job to do whatever I can within my power to help ease their anxiety, explain things to them, show them what I'm doing with the baby, let them be hands-on if they can. Just whatever I can to let them feel like they have some sort of control in this unfortunate situation. That's all you can do as a nurse. At the end of the day, it's not your fault that the baby is here. But I would say that that's the best way to respond to a question like that. They also asked me why I see myself as a NICU nurse and why I want to work for their hospital. That's a common question that you're probably going to get from any unit that you work on, like why you see yourself as a perfect fit or as a good fit for this hospital and this unit. I definitely encourage, you sharing your story, what it is that made you attracted to the NICU. Maybe you've had some sort of experience in your life that influenced your decision to be on the NICU. Like, share all of that. Also, just in general, for like all interviews at every hospital, definitely know the mission and the vision of the hospital, which you could find on their website if you just search it up, and try to incorporate that into one of your answers. Like maybe the one where they're asking you why you see yourself as a perfect fit for our hospital, maybe incorporate a little bit of your knowledge about their mission, about their vision, and how you identify with their mission, how you resonate with their vision. That is definitely helpful and makes for like a good answer for a question like that. Lastly, this was a very important question that they asked me. They asked me, where do I see myself in 5 years? And I answered something along the lines of in the NICU, growing, taking on responsibility. I let them know that this is definitely a place where I want to call my home and like stay. They don't want to feel or hear like, they don't want to feel like you're just using it as a stepping stone to get out. And typically with the NICU, that's not really the case. Like, NICU is typically like an end goal. Like, for a lot of nurses that want to get into that field, you don't really use NICU to get you anywhere else because the experience isn't really helpful anywhere else. So, just in general, for any like position, you don't want to tell them that you're just using it for experience to go somewhere else. Like, you want them to feel like this is where you want to be and that you're here to stay and that you want to grow and take on responsibility and become like a solid member of the team. I hope this was helpful. My DMs are always open. I have been getting a lot of DMs from you guys, so if I'm late in responding, a few days late in getting back to any of you guys, I apologize, but I am on my way to finding you guys. And don't feel like you can't double text me. Literally double DM me and be like, hey, just following up, like whatever you want to say. Just to get your message to go back to the top. But yeah, I hope this was helpful, and leave comments below. I always answer back to the comments, asking any questions you have regarding the NICU, interview process, prereqs, anything like that.